Hey everyone, good morning. This is Dr. David, physical therapist with Paso Manual Physical Therapy, and I want to tell you guys a secret about back pain. There's a ton of different reasons you might have back pain. It could be the joints, it could be the discs, the muscles, the ligaments. There's a ton of things. What a lot of people in the medical community get hung up on is which of those tissues is causing the pain, so they can give you a diagnosis, but it doesn't really matter. We know in the research that you can have a horrible looking MRI, disc bulges, bone spurs, etc., and be pain-free. So this brings us to the question of, I have an MRI with a disc bulge and a bone spur or pinched nerve. Why do I have back pain if that's not the cause? Even doctors get confused, physicians, surgeons, and people have surgery and they might still have pain. People take pain medication, they get pain injections, and that's just masking the pain, but it's not fixing the cause of the back pain. So let me share with you guys the most common problem that I see. Now, let me preface that with saying I'm a physical therapist, which means I'm a movement expert. The most common problem that I see is poor trunk control, poor abdominal control, poor low back control. Now pay attention here, because you might say, I work on my abs all the time. I got strong abs. My abs are not the issue. There's a difference between control and strength. And they're not the same. You can have a lot of strength, but not good control. Even if you're really buff and you work out all the time, you have the strongest abs ever, you can have really bad control. I see it all the time. So let me show you what it looks like in walking to have poor core abdominal control. You ready for this? Watch. You probably see people walking like that all the time. You might find that you walk like that too. It's kind of the sexy walk, the swing your hips walk. It's not good for your back. But let's see it again in slow motion. So how many of you guys have been walking like that? Maybe you've been to the doctor, been on pain medications, tried all this stuff for your back pain, but never fixed your walk. So here's the secret. Tighten your abs when you walk. Doesn't have to be hard, just kind of turn them on and hold them tight. So what you want to do is fix this motion and keep it tight. You're still going to twist a little bit, but twist less. It's going to help your back. Now one side note to worry about is your ab span from here to down here. You want to try to get the belly button down to fire, so get those lower abs on. And don't hold your breath. Don't pass out when you're walking. You should be able to breathe normal when you tighten up your abs. Now, there are some side effects to doing this. You might get flatter abs and stronger abs. So here's what it'll look like to tighten up the abs. Your gut might be kind of hanging out a little bit like this, but you just suck it in and try to suck in from the lower abs more so. Once your abs are tight, you should be able to breathe and talk like I'm doing right now, and it should be a comfortable amount of tightness. It shouldn't be straining at all. Let's take a look at that walk again, but now with tight abs. No more cumbia dancing while I'm walking or swinging the hips. This will be safe for work now. Bad walk. Good walk.
Okay.
Video bomb from Edith.
Flex Friday!
Now you will be surprised when you do this ab control thing for a little while. I mean, even a day or two. If you have back pain, it will get better. This may not be the entire solution to your back pain, but like I said at the beginning, I find this is a very, very common problem with people with back pain. Now let's get a little nerdy with this. I'm going to get into the technical reasons why this causes back pain and why this technique will help back pain. When you're doing that bad walk, what ends up happening a lot of times is the joints are moving on each other way too much at a certain level. This can really irritate the discs in the spine, it can stretch ligaments, it can cause muscles to spasm, it can lead to nerve problems as well. If this goes on long term, you might actually get pain in other areas besides your back, like the hips, knees, all the way down into the foot if it's a nerve problem. Now keep in mind that pain medication, surgery, injections doesn't fix the strength or the control. Make sure you consider how you're moving. Really take a good look at if you're doing that cumbia dance. So that's it for today's low back pain talk, guys. This is Dr. David, El Paso Manual Physical Therapy. Hit me up if you have any questions. One more thing I forgot. I showed you good walk and bad walk. Let's see the moon walk.